what happened, what the pandemic did was accelerated what patients were already both wanting and doing. And what it did was the healthcare system caught up to where patients are.
Hi, everyone. I'm Matt Eyles, President and CEO of AHIP.
And I'm your co-host, Laura Evans. This season of The Next Big Thing in Health is sponsored by Teladoc Health, partnering with health insurance providers to transform the care experience for their members. Visit teladochealth.com/AHIP-2021 to learn about its perspectives on the path forward for integrated virtual whole person care.
Today, our guest is Dr. Garth Graham, Director and Global Head of Healthcare and Public Health Partnerships at YouTube. With more than 2 billion active monthly users, YouTube is an incredibly valuable tool for educating people about important healthcare topics, especially COVID-19 safety measures and vaccines. A cardiologist, researcher, and public health expert, Dr. Graham previously served in 2 U.S. administrations as Deputy Assistant Secretary for Minority Health. Garth, thanks for joining us today.
Oh, thank you for having me.
Could you just start, Garth, by telling us a little bit about your career as a medical provider and then what led you to your work at YouTube?
Yeah, my career. I like the way you said that because it makes it seem as if everything is planned, is like a planned journey. So my career is I'm a cardiologist by training, and so I went to medical school at Yale and did the usual training that clinical cardiologists do. And then I went off into public policy. Spent some time in both the Bush and the Obama administrations, running minority health as a deputy assistant secretary, and really kind of got more passion around things that I've always been passionate about. How do you bring care to underserved communities? How do you think about it from a policy perspective? And earlier on in my medical career, my training, I'd always gotten obsessed with this concept of scale. And, working at the government, in the US government, certainly allowed that. Then I went back into academics, back into research. I was a chief of health services research in the Department of Medicine, University of Florida. Left that and went to work for Aetna as president of the Aetna Foundation, and continued a lot of the work I was doing around underserved communities. And then segued to vice president of community health for Aetna and started working more on the business end of things. And then when Aetna was acquired by CVS, became the chief community health officer eventually at CVS Health, where he worked on a lot of the community health activities. So in general, my career has been driven by this concept of reaching communities at scale, trying to work within organizations that are doing innovative things to improve the health of communities. And that was what attracted me to my current role at YouTube. Just the ability to, one, lead an effort that could change so many lives across the world, but also to look at health and public health from a different angle. And certainly COVID has been an accelerator for those discussions, but that's been if there was ever a barometer or a direction to my journeys, that's been the underscored kind of engine is making a difference is kind of the thing I would say.
Mm-hmm. That's great.
Yeah, and I love the notion about scale too, right? Because you're able to touch so many different people. And, we know, in order to touch that many lives, information and content is really important. So maybe you could share a little bit of your thoughts about why it's so important, you think, especially nowadays, to make credible content front and center, especially during the COVID-19 crisis, and maybe share a little bit about how YouTube is working to amplify accurate evidence-based content.
Yeah, I often, what really attracted me to this role and the things we've been able to do is this idea of the patient experience and the patient journey. Many of us, certain of us who've worked in healthcare from an industry perspective, we tend to think of the industry as a focal point, how the plan delivers care or helps to deliver care, how the the integrated healthcare system delivers care, how the doctor, I worked in private practice, delivers care. But what this experience has really taught me is the patient lens, the user lens, the patient journey. And so you think through the average patient who may leave a doctor's office with a diagnosis. The doctor has articulated to them some clinical issue, and they go home. And then what happens next? So what happens next is they look for information. So they search on Google, they search on YouTube, they use search engines to gather information. Gone are the days when people break out an encyclopedia and break out a textbook. So this is where they get their information, and this is what helps them decide and make decisions, decisions about compliance, decisions about what to do, decisions about their family, decisions about their life. And so to be an integral part of that patient journey at the right time and the right moment is important. So that's where this concept of information quality, as you just mentioned, is important. It's important that we get them the right information that allows them to make the right decision at the right time. And if you think through, again, just even our own individual life experiences, it's hard to pick up the phone and call the doctor at 3 in the morning when you get that other thought and that other fear or that other question. But you pick up your phone, and that's what you'll do in the middle of the night to get the answer. And so you pick up your phone and you look for information. That's where services like ours play that very integral role in healthcare and public health. And with COVID, that was a very important point because the search for health information on our platform and other similar platforms escalated. And that's because people were going to the platforms looking for health information. And that's where we partnered with, the federal government. We partnered with Dr. Fauci and the folks from NAID to get information out. We partnered with a lot of academic institutions. We partnered with a lot of influencers on the platform who have that audience to help deliver information. And so that's where I think both the healthcare journey, the journey around COVID, the exponential growth for which people are looking for health information on our platform and similar platforms played a role. And so that's how I vision both past, present, and future of how I think we're going to help patients and communities on their journeys as they live their lives and make decisions about their own health.
Such a great need, huge right now. But as you know, Garth, there's so much misinformation out there these days. It's really hard to know what to believe. So what's your best advice for consumers on how they make sure that the health information that they're viewing online, whether it's YouTube or elsewhere, can be trusted?
Yeah. The source of information is certainly a big factor in that. And I think that's where, we have tried to amplify credible sources. And then we have some plans in the near future for how we help patients, users in the community help think that through some more. But I think, credible sources are as one starting point, sources that have a track record of expounding evidence and articulating health and public health in a way that is reflective of the evidence and the science that we have. And so, the flip side of good quality information is misinformation, as you pointed out. And so we have to think through how we actively remove misinformation from platforms like ours and supplement that with quality and engaging information.
Mm-hmm. So that might be a good time to pivot to health insurance providers and given your career journey, and thank you for sharing, your experience there. You're pretty familiar with how health insurance providers work and operate. What do you think about their role in terms of connecting people with reliable health information?
Oh man, I think health insurance, plans, health insurance providers are a key part of it. And here is why. They're already a part of the patient journey. They're a provider of how patients are connected to services, and in many ways help provide the patients with information. The challenge we have, and I try to be frank when I say this, is people aren't looking for that letter to open up and then read, how do you treat your diabetes? They're not going to sit down there and read through those documents that we send in the mail, right, from health plan world. So then how are we reaching them? How are we engaging them? How are we making sure the diabetic understands the diabetes diagnosis, what hemoglobin A1C means, and how to do these other things to control their diabetes? And that's where this innovation around health information starts to take place. Health does not occur anymore in doctors' offices and even in hospitals. They occur when people are out in the world making their decisions. And so that's where plans, have the ability to work with us, work with others, to get out information in an engaging way where people are making decisions. And so, I mean, I think that, and the good thing is, the health plan world is leaning into patient-centered care and innovation in a way like never before. So telemedicine, all of those components are one part of it. And now, what's important for them to think through is the patient experience, the patient journey, and how are they reaching patients? How are they reaching patients at a key moment in time when they're making those kinds of clinical decisions that are going to affect their health outcomes.
Teladoc Health, the leader in virtual care since 2002, has built the only scalable platform for integrated whole person solutions. A partnership with Teladoc Health helps ensure that health insurance providers, employers, hospitals, and health systems are prepared for the future by supporting the growth of virtual care. To learn about Teladoc Health's perspectives on innovating to ensure access to integrated, virtual, whole person care for everyone, visit teladochealth.com/AHIP-2021. And you talk about telehealth, telemedicine, you talk about, patients looking at YouTube in the middle of the night too. Do you think we're actually seeing a more permanent change in how people are consuming healthcare information? And will this change, be here to stay beyond the pandemic?
Oh, it's changed. I think, what happened, what the pandemic did was accelerated what patients were already both wanting and doing. And what it did was the healthcare system caught up to where patients are. So, patients already wanted to interact with their provider. Sometimes, especially if it's not a very serious clinical illness, the role of telemedicine and the ability to interact in more convenient ways was always, out there. But now what patients want of us now been accelerated. Then the role of platforms like ours has been accelerated by the pandemic, because we now know that we're an active source of information for health. And we knew that before, but now the rest of the world knows that even more. Let me put it that way. And so understanding how that drives health outcomes, drives population level and individual decision making is, I think, with us to stay. And that's why this idea of how we be more innovative. One thing I'll just say is, you would have never told me that my mom would ask me to explain what messenger RNA means, or that people would want to understand what herd immunity means and what's the calculus that went into that. And all of these are complicated terms that you would normally have to pull out your old textbook to say, well, RNA starts here, the ribosomes are here, and all of those things. They don't want to hear that anymore. They want somebody who's going to break it down and explain it in layman's terms, in culturally specific terms. And that's where platforms like ours and that kind of dynamic, is part of the evolution. But truth be told, given the visibility that public health has had in this past year, and the importance of health and public health information, I think all of these changes are here to stay, which is for the better, because it empowers communities and patients to make the right decisions.
And let me ask you a quick follow-up on that, because you talk about the culturally appropriate language and this change in driving health outcomes. Do you have any proof or any statistics to show that the effort and the work that you're doing on YouTube is actually driving the change? Are you seeing that change right now?
Yeah, and so certainly a lot of what we're starting, what was started, particularly during COVID with this effort, is new. So we're seeing a lot of evolution. But you see, there's a lot of data looking at how people engage with platforms like ours, and how that has helped to drive some of the kinds of decision making in general. We published a paper with the group I used to work at Johns Hopkins, looking at smoking, and how digital tools, like the tools that I'm talking about that in our platforms and others, help to help patients with their decision making. And that's part of what has gone into the calculus of again, I simplified it by saying that, people aren't, waiting for that billboard or that mailer or that pamphlet anymore to make their decisions. That's part of understanding how these digital tools are incorporated already into people's daily lives. I mean, just think about your own life. When you want to find out, if I tell you a diagnosis, anything impacting your own life now, you're not going to wait till you can get into your doctor's office. You're going to look it up. You're going to want to know what this has mean for me. And so having the right information that helps supplement that discussion that you have with your clinician is I think part of where we are now. But again, as we were saying to answer the prior question, part of where we are going to continue to go in the future.
Empowers the patient. Yeah.
Yep.
Yeah, and the platform is so powerful when you think about how many people you can reach. And also, there's such demand for content. People, right now, everyone is looking for, new information that's useful to them. And I think, as you mentioned, Garth, connects with them and is easily understandable. What do you think the qualities are? I'm an aspiring healthcare video creator, and I want to put some content on YouTube. What recommendations would you have for me?
Yeah, I mean, I think the recommendation in general sticks to this broader concept of what we know about health information. So what works for health information? Engagement, resonance, and then in terms of linking the health outcomes, the evidence. And so, what I think through this, I often say that, think about your audience, think about who you're trying to reach. If you're a plan and you need to reach this group of people, think about those characteristics, the culturally specific characteristics of that group, and then tailor the message towards them. And that's where platforms like ours and others, because this is really about the power of video, if you think about it at scale as a messenger. Think about how it's going to be received. One of the things that we often don't think about in healthcare, because we are so industry centric as opposed to patient centric, is then when they have received that information, what's the next driving action? What's the next thing we want to empower them to do? And so those are the kinds of ingredients I would say. I would think about engagement. I think about the kind of resonance. I would think about the audience. I think about the community. I would think about the evidence that you want it to transfer to the community, and then also making sure that we're linking that with action and purpose. I think are some of the key factors.
Mm-hmm. So let us pick your brain for a second. So since you're in this world, what are some of your favorite channels and sources of information?
I have been particularly drawn to the channels and source of information that have been accelerating the transfer of medical information. So for instance, there's a group called Global Health Media. There's also a group out of Stanford called Digital Medic, and they're particularly interested in how do you reach third world audiences, particular audiences in India, the health worker audiences, and they use the channels to transfer health information to community health workers in those locations and empower them with the evidence base. And why I love that kind of stuff is, again, gone are the days where we're waiting for 10 years to translate evidence at the bedside. I mean, we produce vaccines right away, people want it right away. Yeah. And so now we know we can transfer information and empower and translate information quickly. And so those platforms, those channels, they utilize a platform as a tool to help, translate public health training, medical information to community health workers in third world conditions, and also provide us that. Now you think about that. Now you think about what we can do with that in the United States, and we think about how we can get, information to, again, not for the worried well, but how can we train our community health workers or frontline workers? How can we get information to folks who are working in community health center settings, who may be in the Bronx, who may be, in South Florida in some community, or, all these different versions of communities where, again, it takes so long for evidence to get there. Watching these are examples where, again, think about it from the plan world. these are examples of where health plans could adopt a similar infrastructure of how do you create information that is then utilizable for community leaders and community health workers in settings to help improve the care of those communities.
Garth, you've been so generous with your time and such really interesting perspective. Maybe one final question for you, and it's one that we ask all of our podcasters with us here. What do you think the next big thing in health is? And it could be about health information or any other topic that's important to you.
You know, coming out of the pandemic, this idea of person-centric care is going to be even more important. And why do I say that? You know, we're seeing where individual decisions about, say, whether they take the vaccine or whether they get tested for COVID or whether they wear a mask or do all of these things are driven by, you know, dynamics that has to make that information reach them. And so I think one of the things you're going to see coming out of the pandemic and the future of healthcare is the ongoing evolution, the ongoing goal that we have of truly patient-centered, consumer-centric care, not where it's the provider is the center, but the communities are the center. And I think that's a journey that we are on right now. We got to work to improve the trust that our communities and patients have in our healthcare delivery systems, in our government institutions, in other sources of information. But this is broader than information delivery. This is also about, you know, vaccine delivery being local and healthcare being local. So all of these point to an evolution of health and public health that is more patient, consumer, user, community-centric than we were maybe a year ago.
Yeah, Garth, thank you so much for being with us here today. Really love your perspective, so diverse, and your career has taken so many interesting twists and turns. It's great to hear. It's great to hear about it.
Yeah, we appreciate your passion too, and your good work. So thank you for joining us.
Thank you guys for having me. I love what AHIP does for the industry and what you've done for our community. So thank you for having me.
Recognizing the critical role that virtual care plays in the healthcare delivery system, Teladoc Health helps health insurance providers coordinate and deliver care for all members, including their highest risk populations, by providing a front door to care. From chronic condition management to mental health to primary care, Teladoc Health personalizes and integrates whole person care for members. Visit teladochealth.com/AHIP-2021 to download our brochure and learn how virtual care is delivering value as the preferred entry point to health.
Thanks again for tuning into this episode of The Next Big Thing in Health. Be sure to sign up for our email list at ahip.org/nextbigthing. Subscribe and share with your friends too. Thanks for listening and see you next time.